Hello, Dr. Brian Scott here today to talk to you about light therapy. And so the neuropathy relief light therapy pads comes with two pads. So can have one for each foot or one for each hand, wherever that neuropathy is. And it is a very powerful modality. It's really, really a good idea if you have peripheral neuropathy to consider using light therapy. There's quite a bit of research pertaining to the benefits of light therapy, and we use two sources of light in each pad. So we use LED lights and we use infrared lights. The reason for this is because the LEDs focus right on the surface of the skin, where the infrared can travel as much as an inch deep, so it can really get down in there to create some of the similar physiological effects deeply. And of course, with neuropathy, we want to heal on the skin surface, so we have better tactile senses and we don't have senses we shouldn't have. We have the right ones there. And also, of course, deep as well. So we want to affect both those. This light therapy allows you to do that. The light therapy that we have with neuropathy relief, it's automatic. You push a button, it goes for the required amount of time, which is 20 minutes. That's optimal, and it'll shut itself off, which really makes it easy. Extremely easy to use. You basically put your feet right on them, put them on the floor, put your feet on them, or you can strap them to the bottom of your feet if you want to recline in a chair, something along those lines. If you're using it for your hands, you can put it right on your hands and just set your hands right on it. Let it do its thing. Once a day, twice a day, perfect. And so what this does, the reason for light therapy is it increases the production of new blood vessels, and blood is where the components of healing are going to come from, right? To help to heal up those nerves that are not functioning correctly. With peripheral neuropathy, the nerves are sick, they're dying, they're damaged, they're not getting the support they need to function correctly, and that's why your symptoms are what they are. You might have pain, you might have numbness, you might have loss of balance, you might have muscle cramps, you might have weird sensations, you might have electric storms, things may not feel like they should or used to have felt to you. So light therapy is one of those tools you can use to help your body to recalibrate the nerves, to create new healthy peripheral nerve tissue, and to reduce your neuropathy symptoms, hopefully get rid of them over time. Your body will continue to heal even with long-term use of this type of therapy, and heals wounds. I've had people with diabetic ulcers that were not healing. They had been told they were probably going to be candidates for amputation because it had been months and months, and they just literally were not healing up. Light therapy was able to assist them in healing these diabetic ulcers. Increases collagen production, so it's healthy for the skin, the elasticity of the skin. You'll notice that half the lights are red, the other half, you can't actually see them illuminate with the naked eye because that's the infrared light, so it's outside the visual spectrum. So half of them are red, half of them are outside the visual spectrum, so they just look clear. And you do that, it's gonna go for 20 minutes, you relax, you multitask, watch TV, you read, you do something else while it's taking place. Very comfortable. And you can be lying, sitting, very compact too. So when you're not using them, you can slide it under a table or put it in a drawer or something along those lines. And it doesn't take up a whole bunch of space. And so light therapy is something to consider. I really have all of my neuropathy patients use light therapy. It's that important for somebody with peripheral neuropathy. So something to consider on your journey if in fact you're suffering from this condition, this peripheral neuropathy condition.